3 decades ago, amidst a landscape of challenges and health disparities, NHMA emerged as the beacon of hope for Hispanic physicians across the nation. The organization became a hub for young Latino professionals breaking barriers and making their mark in academia, research, and private practice, and also in public health. From the very beginning, the mission was clear: to inspire and support Hispanic physicians and other healthcare professionals in their pursuit of excellence.
We are different, and we are going to create an organization that is very different and that will really advocate as well as produce the science and the services of high quality that we need to produce to better serve our communities and our nation.
And thus the National Hispanic Health Foundation was also born, a sister organization dedicated to advancing health equity and improving the well-being of Hispanic communities through research and education and advocacy. Together, NHMA and NHHF embarked on a journey marked by milestones and achievements that would shape the trajectory of Hispanic healthcare for years to come. From working with government agencies on healthcare reform to the establishment of leadership programs and involvement in advocacy efforts for prevention, for obesity, for heart disease, for diabetes, we have been unwavering in our commitment to advancing the health and well-being of Hispanic communities in the United States.
Through its Leadership Fellowship Program, affiliated with NYU's Wagner Graduate School of Public Service, NHMA continually promotes leadership development.
I became a fellow in 1999, and I was a graduate of the first group. It has completely moved and changed my career. The first time I came as a fellow, I heard about the Centers of Excellence, and I said, why not us in New York? And now, about 3 years later, we have a Center of Excellence. It's made a huge difference.
The story with the Hispanic Center is very unique and interesting. Elena Rios helped me. We were applying for the Hispanic Center of Excellence, and we became the first Hispanic Center of Excellence in New York. And we had trouble. We were having troubles, and we were hoping that we would get some support for our grant. And Elena and I took the little train to the Capitol, and we visited the Congress people from New York State, and we got a letter from all the Congress people that is now, kind of framed and posted, so that we got our visit, and we got our grant.
So to me, when I talk to Latino physicians about it, I tell them it's important for us to organize, to come together, and I think that they would find that coming to the NHMA would be a great place to meet people like themselves, to network, to connect, develop relationships. And that's in fact what happens. I mean, when I think about the friends and the people that I know, most of them that are Latino physicians are through this organization, because the reality is there aren't that many Latino physicians to begin with. So it would be hard to go on find them on your own,
I think now we are in a position to bring in a lot of young Latino leaders who will then take over the organization. They are going to be our leaders, and in many ways they are already leaders in their own capacity.
And so we've been able to strategically place Hispanics in positions where their voice can be heard.
In NHMA, you can start as a member, pretty much move into the board, and have a lot of experiences in leadership that perhaps will not be available to you either as rapidly or at all in other organizations. We're also representatives. We have to take that very seriously. These are not times to take for granted the rights and privileges that we've had or the opportunities. It's time to make sure that we focus on them, that we know that we have the legacy that we want to lead and to leave for our students and our members.
NHMA has stood as a testament to the resilience and determination of a community striving to overcome barriers to equitable healthcare. But perhaps our greatest achievement lies in our unwavering dedication to community engagement, recognizing the importance of having a voice in Washington, D.C., and advocating for policies that address the unique healthcare challenges faced by Hispanic communities. Through initiatives like leadership fellowships and mentorship programs and scholarships, we have nurtured the next generation of Hispanic healthcare leaders, empowering them to advocate for their communities with passion and purpose.
I want to thank the National Hispanic Medical Association and the National Hispanic Health Foundation for recognizing my work and providing me with the scholarship, which is definitely nice, especially going to medical school, which is very expensive. Milda Soto and Elizabeth Lee and Nelly Correa, because at the medical school, they're really the driving force to ensure that Hispanics are well represented and our health issues are brought up.
Together, we have made history, and together we will continue to champion the health and well-being of Hispanic communities for generations to come.